So there's a clear difference between general mental well-being and mental health disorder. Let's imagine this scenario. If you feel a severe headache, you would possibly rush to the hospital to check if everything is okay with you, right? Or if possible, you would expect your medical doctor to prescribe some form of medication to lessen your pain. Is that not so? So this is the same way with mental health. Let's say you are going about your daily life, but something feels off. You're unable to put your finger on what exactly the problem is, but deep down, you sense that your mental well-being might be slipping away. In the same way you would rush to the hospital if you had headache, you should equally rush to the hospital to see a psychologist or a mental health professional to check in with yourself and know if everything is okay with you mentally. If the psychologist or mental health professional feels something is not right with you, just like the medication the doctor would give you for the headache that you're experiencing, the psychologist would equally take you through therapy or recommend medication in severe cases to manage your pain and improve your well-being. Even in cases where you get diagnosed with a mental health disorder, consider this to be the regular diagnosis of diabetes or hypertension. There will be medications and therapy to correct or manage the disorder if you get diagnosed. Hi, I'm AC Hatto, a licensed clinical health psychologist, and I make mental health education videos. This channel is a community of like-minded individuals who are on a journey to create awareness of mental health with the hope to break the stigma that surrounds it. So if this sounds like you, join the family by hitting the like button, subscribing to the channel, and sharing your experiences in the comments below to encourage and inspire others. The first sign that your mental health is declining is constant mood changes. You might notice yourself always feeling sad, always anxious, and quick-tempered for long periods. For example, you might find that you are frequently shouting at your loved ones over minor issues or bursting into tears over obviously insignificant matters. We all experience sad moments on certain days, but the emphasis here is on constant mood swings that won't go away for days. And this might begin to affect the way you interact with people around you. The second sign is withdrawal from social interactions. If you've noticed a sudden reluctance to engage with people or activities around you that seems to persist for a number of days or weeks or even months, that should be a red flag. Let's say perhaps you found yourself cancelling plans with friends, withdrawing into your own world, or losing interest in activities that used to bring you joy. This withdrawal from social interactions can be a clear signal that your mental health needs attention. The third is changes in sleep patterns. Keep an eye on any changes in your sleep pattern because insomnia or excessive sleeping can both indicate that your mental health might be declining. For example, you might struggle to fall asleep or stay asleep throughout the night, or you may find yourself sleeping excessively, spending most of the day in bed due to the lack of energy or motivation. Another sign of mental health decline is reduced concentration and focus. Let's assume you're sitting at your desk, trying to get work done as usual, but your mind keeps wandering off into a state of confusion. Your once sharp focus has become dulled, making it increasingly difficult to complete even the simplest task. If this sounds familiar, it's time to acknowledge that your mental health might be sliding away. The next sign, which is mostly ignored, is physical ailments with no clear cause. Sometimes our minds may manifest distress through physical symptoms, so frequent headaches, unexplained body aches, digestive issues, or other physical complaints without a clear medical cause might be linked to your mental health. For example, you may experience constant headaches or migraines that have no apparent physiological cause but coincide with periods of high stress or emotional turmoil. Another clear signal of decline in your mental health is the increase in drug or substance use. Life's challenges can push us to seek solace in unhealthy coping mechanisms. If you've noticed yourself drinking alcohol more often in larger quantities to say numb your emotional pain or cope with anxiety, or constantly using drugs like even painkillers to numb your pain or cope with your emotions, it's time to recognize that these temporary escapes might be covering deeper mental health concerns. The next sign is overwhelming feelings of hopelessness. Persistent feelings of hopelessness or thoughts that life is not worth living are alarming signs of declining mental health. If you experience suicidal thoughts or feelings, it's essential to seek immediate medical help from a trained mental health professional or call a helpline. For example, you might find yourself frequently thinking about death, feeling like there's no way out of your current situation, or contemplating self harm. The seventh sign of decline in your mental health is neglecting your self care and responsibilities. Life's demands can sometimes feel overwhelming, but if you've noticed a consistent pattern of neglecting self care routines, such as skipping meals, neglecting personal hygiene, or even struggling to fulfill your daily responsibilities, it's time to pause and assess your mental well being. The next is loss of interest in hobbies and passions. Think back to the activities that used to awaken your soul with passion and joy, but now they sit untouched, no longer interesting to you. This loss of interest in hobbies and passions can be an obvious sign that your mental health needs attention. The last sign for today is difficulty coping with stress. Everyone experiences some form of stress, but if you find yourself consistently overwhelmed and unable to cope with daily challenges, it might be a sign that your mental health is declining. For example, you might find yourself becoming extremely anxious, agitated, or panicky in response to minor stresses such as traffic or a small disagreement with your friend or your partner. That'll be all for today. I hope this video empowers you to be more in tune with your mental well-being. Remember, it's okay to ask for help, and we are all here to help you overcome your mental health challenges. Don't forget to leave a lovely comment below or share your experiences in the comments so others can benefit. Also, hit the like button and press the notification bell so you'll be the first to get notified when I upload a new video. Until next time, I wish you a great day. Bye.